Hey everyone, today we're diving into a topic that many of us or our loved ones have dealt with, snoring. Whether it's the occasional snore or a nightly battle, we'll be answering why people snore, what causes it, the potential complications, and most importantly, what can be done to treat it. So, stick around because this could help you or someone you know sleep a lot better. Let's get started. Chapter 1. Why do people snore? Snoring is the sound that occurs when air flows past relaxed tissues in your throat, causing them to vibrate as you breathe. It's a pretty common issue, with about 45% of adults snoring occasionally and 25% snoring regularly. But what exactly happens during snoring? In simple terms, when you sleep, the muscles in your throat, tongue, and soft palate relax. In some people, this relaxation can cause the airway to become partially blocked, leading to those all too familiar snoring sounds. Chapter 2. What causes snoring? So, what are the key causes of snoring? Well, several factors can contribute to this condition. Let's break them down. Nasal congestion. If your nasal airways are blocked, it forces you to breathe through your mouth, which can increase snoring. This can be caused by a cold, allergies, or a deviated septum. Sleeping position. Sleeping on your back can make snoring worse because it encourages your tongue to fall back into your throat, blocking the airway. Obesity. Carrying excess weight, especially around your neck, can put pressure on your airway, making it more likely to become blocked during sleep. Alcohol and sedatives. These relax your throat muscles, making it easier for your airway to collapse and causing snoring. Age and genetics. As you age, your muscles naturally lose tone, including those in your throat, which can contribute to snoring. Some people are also more likely to snore due to their genetic makeup. Sleep apnea. Finally, snoring can be a sign of a more serious condition called obstructive sleep apnea, which we'll talk about in more detail soon. Chapter 3. Complications of snoring. Now, snoring isn't just a minor annoyance for your sleep partner. It can actually lead to more serious complications if left unchecked. Interrupted sleep. Frequent snoring can disrupt your sleep, leading to daytime fatigue, difficulty concentrating, and even mood changes. Strained relationships. Snoring can put stress on relationships, especially if one person's snoring forces the other to lose sleep or even sleep in a separate room. Health risks linked to sleep apnea. If snoring is due to sleep apnea, you could be at risk for more serious health issues like high blood pressure, heart disease, stroke, and type 2 diabetes. Chapter 4. How is snoring diagnosed? So, how do you know if your snoring is a sign of something more serious like sleep apnea? Diagnosis typically starts with a visit to your doctor. Medical history and symptoms. Your doctor will ask you about your symptoms, including how often you snore, whether you stop breathing during sleep, and whether you feel rested in the morning. Sleep studies. In some cases, your doctor may recommend a sleep study, also known as polysomnography. This is done either in a sleep lab or at home, and it monitors your brain activity, breathing patterns, oxygen levels, and more. Home sleep apnea testing, HSAT. For less severe cases, a home sleep test may be used to diagnose obstructive sleep apnea. Chapter 5. Treatments for snoring. Now, let's talk about the good news. There are several treatments available to help reduce or even stop snoring altogether. Lifestyle changes. If your snoring is mild, some simple lifestyle adjustments might do the trick. Weight loss. Losing weight can reduce the pressure on your airway. Sleep position. Sleeping on your side rather than your back can help keep your airway open. Avoid alcohol and sedatives. Reducing alcohol intake, especially before bed, can minimize snoring. Nasal strips and nasal sprays. Over-the-counter nasal strips can help open up nasal airways, and nasal sprays can reduce congestion. Oral appliances. If your snoring is more severe, a dentist may recommend an oral appliance that moves your jaw forward to keep your airway open during sleep. CPAP machine. For people with sleep apnea, the most common treatment is a continuous positive airway pressure (CPAP) machine. This device keeps your airway open by delivering a constant stream of air through a mask while you sleep. Surgery. In more extreme cases, surgery may be needed to remove tissue that blocks the airway or to correct structural problems like a deviated septum. So, snoring may seem like a simple issue, but as we've seen, it can be caused by a variety of factors and lead to complications if ignored. Fortunately, with proper diagnosis and treatment, most people can significantly reduce or even eliminate their snoring. If you found this video helpful, make sure to hit that like button and subscribe for more health tips and advice. And don't forget to share this video with anyone who might be struggling with snoring. Thanks for watching, and sweet dreams. See you in the next video.